So we hear all the time about the promise of AI in healthcare, right? But what actually happens when you take a powerful language model and drop it into the chaos of a real-world clinic? Well, today we're going to break down a really pivotal study out of Nairobi, Kenya that did just that. They deployed an AI to help out primary care clinicians, and what they found about its impact on patient safety, well, it's pretty remarkable. All right, so here's our game plan. We're going to start with the big problem this study is trying to solve, that gap between AI hype and reality. Then, we'll look at the actual tool they built, this AI safety net. After that, we'll get into the nitty-gritty of the experiment itself, look at the hard numbers on clinical errors, and of course, talk about the human side of things. And to wrap it all up, we'll cover the big lessons and the questions we're still left with. Sound good? Let's jump in. Okay, Section 1, the healthcare AI chasm. This really gets to the heart of the problem, right? It's all about the gap between what these incredible AI models can do on paper and the actual impact they have out in the real world. You know, the researchers make this really powerful point. They argue that the biggest roadblock for AI in medicine today, it isn't actually the AI models. We've got models that are incredibly powerful. The real problem, the thing holding everything back, is what they call the model implementation gap. It's this huge chasm between what an AI can theoretically do and what it takes to make it work successfully day in and day out in a hectic clinic. And the setting for this study really puts that gap under a microscope. We're talking about primary care clinics in Nairobi. The clinicians there are dealing with a huge range of conditions, just massive patient volumes, and they don't always have a ton of diagnostic resources. It's a high-pressure cooker of an environment where just following the standard guidelines can be a real struggle. And that makes it a super challenging place to work, but also kind of the perfect high-stakes testing ground for an AI assistant. So, okay, given that challenge, how in the world do you build an AI tool that clinicians will actually use and benefit from? That brings us to our next section, building the AI safety net. And this was not something they whipped up overnight. This was a tool designed very intentionally, years in the making. And this is so important. The organization behind this, Penda Health, they didn't just take a fancy new LLM and parachute it into their clinics. No way. You can see here, they've been on this digital journey for a while. They started with an EMR back in 2017, then they brought in a simpler rule-based system. They kept iterating, learning, and refining, all before they even got to the sophisticated AI safety net that they ended up studying. It's just a masterclass in how this stuff should be done, slowly, deliberately, and iteratively. And the philosophy behind this final tool, the AI Consult, is absolutely key. It was not designed to be some all-knowing oracle that tells doctors what to do. Not at all. The whole idea was for it to be a safety net that runs quietly in the background. Think of it like a co-pilot. It's constantly reviewing every decision, but it only speaks up when it sees a potential problem. The clinician is always the pilot in command. Now, how do you do that without driving clinicians crazy with notifications? With this really smart, really simple traffic light system. If everything looks good, you get a green check mark. Simple. If there's a moderate concern, you get a yellow bell, a gentle nudge you can check out if you want. But if there's a serious safety-critical issue, you get a red pop-up that you have to review. This design is just brilliant because it's how you avoid alert fatigue, where people just start ignoring alerts because there are too many of them. It's a huge problem, and this design tackles it head-on. Okay, so they built the tool, they had the design philosophy, now it was time to put it to the test. And this wasn't some tiny little pilot study. This was the real deal. A full-blown experiment to see what kind of impact this AI safety net could actually have. And just look at the scale of this thing. This is impressive. We're talking 15 clinics, over 100 clinicians, and almost 40,000 patient visits analyzed. They used a cluster-assigned design, so half the clinicians got the AI tool, half didn't. And here's the part that makes this study so solid from a research perspective. The quality of care for every single one of those visits was rated by independent doctors who had no idea which group they were looking at. That blinding is absolutely crucial for rigor. Here's another really smart thing they did. They didn't just flip a switch and say, go. The rollout had 2 phases. First, an induction period, where clinicians could just get comfortable with the tool, no pressure. Then came the active deployment phase. This is when they brought in peer champions, coaching, performance metrics, all the stuff that actually drives adoption. And this is such a key takeaway, right? Technology alone is never enough. You have to actively manage the change process. All right, Section 4. This is the moment of truth, the verdict on clinical errors. So after all that careful design and deployment, did it actually work? Did this AI safety net prevent mistakes? And the answer is a resounding yes. The headline finding is right here.
Clinicians who had the AI safety net made significantly fewer mistakes. I mean, look at this, a 16% drop in diagnostic errors and a 13% drop in treatment errors. Now, those might sound like just percentages, but in a real clinical setting, a reduction like that is a huge deal. That's a real, meaningful improvement in patient care.
Okay, let's geek out on the data for a second, because when you dig in, it gets even better. This table shows the relative risk reduction, or RRR, across different categories. But what I really want you to look at is that NNT column. That stands for number needed to treat, and it's a super practical way to think about impact. It tells you how many people need to use an intervention to prevent one bad outcome. So for treatment, the NNT is about 14. That means for roughly every 14 patients a clinician saw using this tool, one treatment error was avoided. For a quality improvement initiative, that is an incredibly low and efficient number. So what do all these percentages and NNTs actually mean in the real world? Well, the researchers ran the numbers. If they rolled this tool out across all of Penda Health's clinics, they estimate it would prevent, wait for it, 22,000 diagnostic errors every single year. That's not a theoretical number. That's the kind of massive, real-world scale we're talking about here. But listen, the numbers, they only tell half the story. To me, the most fascinating part of this entire study is the human factor. How did the clinicians actually use this thing? What do they think of it? How did it change the way they worked? Okay, just look at this. This is honestly wild. They asked the clinicians who used the tool, hey, did this thing improve the quality of care you deliver? And 100% of them said yes. Not 90, not 95, 100%. And 3/4 of them said it substantially improved their care. Anybody who's ever worked on rolling out a new digital health tool knows getting feedback like that is basically unheard of. It just doesn't happen. And this quote from one of the clinicians just brings it all home. They said, it has helped me in multiple occasions to make the correct clinical judgment. It always alerts whenever there's a quality concern, can see the small things we overlook. I mean, that's it, right there. It's not about the AI replacing the clinician. It's about it being a partner that helps them catch those little things that are so easy to miss when you're busy. It's an enhancement, not a replacement. But now we get to what might be the single most powerful finding in this entire paper, something they call the learning effect. So the researchers looked at how often a clinician's first plan, before any AI feedback, would have triggered a critical red alert. And what they found was amazing. For the group using the AI, that rate actually went down over the course of the study, from 45% to 35%. The control group, they stayed flat. Now just think about what that means. The AI wasn't just catching mistakes. It was actually teaching the clinicians to think differently and avoid making those mistakes in the first place. So the AI consult tool became more than just a quality check. It was acting as this continuous case-by-case educational partner. It was literally making clinicians better at their jobs, in real time, with every patient they saw. And that, right there, is a really profound shift in how we should be thinking about the role of AI in medicine. Okay, so the results are obviously incredibly impressive, but for a proper scientific critique, we have to talk about the other side of the coin. What were the limitations? What are the lingering questions? Because no study is perfect, and understanding the trade-offs here is absolutely key. Which brings us to the big question. Was it a perfect success? Let's take a hard look at the limitations. And I have to give credit to the researchers here. They were incredibly open and transparent about all of this in their paper. So what were the trade-offs? Well, for one, they didn't see a statistically significant jump in patient-reported outcomes. Now, the study might have just been too short to pick that up, but it's an important finding. Also, there was a classic quality versus time trade-off. The clinicians using the AI took, on average, about 3 minutes longer with each patient. And maybe most importantly, patient safety reports showed that some of those critical red alerts were still ignored, which is a crucial reminder that the AI is a co-pilot, not the pilot. The human clinician is and has to be the final call. And that leaves us with this final, massive question. What this study really seems to show is that getting AI right in healthcare isn't just about having the smartest algorithm. It's about a whole package deal. You need a powerful model, yes, but you also need a thoughtful design that works with clinicians, not against them. And you need an active, human-centered deployment strategy. So the question is, could this model, this combination of tech, design, and implementation, be the blueprint we've been looking for to finally bridge that AI chasm and safely scale this technology in healthcare all over the world? This research makes a pretty compelling case that it just might be.